All right, so in this video, I want to share with you specifically who this hip pain relief course is for, who it's not for, and other things. So who is this for? Well, I can tell you right now, this is going to be for you if you're struggling with your hip hurts, right? And you're having a hard time moving. Typically, people with hip pain have a hard time moving. So you've got this desire to spend time with your family, and maybe you're not because they're going on a bike ride, they're going on a walk, they're going on a boat ride, and those things hurt your hip, and so you're not maybe spending as much time as you want to. A lot of times it's if you're not sleeping well too because it's hurting, that can be an issue. A lot of times people are losing independence, right? So if you're losing independence and you can't do the things that you once did on your own, and you're asking people for help, this is going to definitely resonate with you. Like I mentioned, sleeping at night, if you're having a hard time because of the pain, this is going to help with you, help you with that. If you're letting pain rule your life, right? So I talk to many people that they can tell the time of day by their medications because the pain starts to kick in at certain intervals, 4 to 6 hours after they take their last pill. If you're worried about not being able to take care of your family, maybe you're having a hard time doing your job, right? Maybe you're having a hard time taking care of your house, inside and out. And ultimately, if you want to try to avoid high-risk procedures, well, what's a high-risk procedure? A high-risk procedure is an injection or a surgery. Those things where they're invasive, they can have bad things. About 20% of the time, someone has a hip replacement or a hip surgery and something bad happens. Typically things like a blood clot or pneumonia because they're not moving, or an infection, right? And then medication side effects. We take so many medications to mask the symptoms or to alter our brain's perception of pain, but all those medications have side effects, right? Even something as simple as Tylenol for pain relief, that's a huge amount of people that have negative side effects each year from Tylenol. So this is going to be for you if you kind of are desirable, those things make sense to you. So who is this not going to be for? Well, I can tell you, if you're forced to watch these videos by a spouse or a doctor or an insurance company, you're probably not going to enjoy it. If you're looking for a quick fix, this is probably not going to be it because there isn't a quick fix. We're going to talk about how this is a movement problem, the way our body has lost movement over time. And so it's not a quick fix, but it is a fix, it's just not quick. So if you're looking for the quick fix, typically those are only treating the symptoms of pain. They're not taking control of the problem and fixing the problem. If you don't want to take control of your health, this is probably not going to be, if you're just looking for someone to passively do it for you, you don't want to actually be involved, then this is probably not going to be for you. And again, if you just want to have surgery and you don't want to try conservative methods that allow your body to heal naturally, you're probably not going to enjoy this. So when I meet people, and myself included, dealing with hip pain in the past, there's a lot of issues with it. It's not just that it hurts, it's that you're worried. There's anxiety, right? You're worried, is it going to get worse? Am I going to need surgery? Am I not going to be able to walk if I let this thing get out of control? What am I going to be missing out, right? Maybe I'm not golfing anymore, which for a lot of people is a big deal because that's the social aspect of their life. I've met somebody recently who had travel plans after they retired to get on a sailboat and go around the world, and they couldn't do it because they couldn't navigate the boat because their hip was hurting so bad. I've met many people that are worried about not being able to do their job, especially physical jobs like manufacturing, or I can think of recently a garbage man who was worried because he's having a hard time getting in and out of the truck. A lot of people are worried about long-term problems, right? And so what are some of those long-term problems? Well, if your hip's hurting and you're not moving, it increases your risk for things like obesity, heart disease, cancer, diabetes, and depression. Those are major long-term problems. People are worried that this is just going to be like this. There's nothing you can do, and it's just I'm getting old, and this is my new normal. And a lot of people are thinking about surgeries. And then I meet people that are frustrated. What are they frustrated about? Well, they're frustrated because they've tried things that they've failed, right? So they've tried lots of different medications, creams, ointments, braces, different types of treatment, injections, physical therapy, chiropractic, massage, lots of things, laser treatments. tons of things that we do that really only mask the symptoms. And so they're frustrated because they feel like the healthcare system has let them down. They're also really frustrated about the things they can't do. I call them the INGs. The stepping, the reaching, the walking, the climbing, the sitting, the squatting, the bending. Those are things that get affected, right? They're also frustrated with inconsistent information. You might go to the hip guy, the hip specialist that says it's the back, and the back specialist says it's the hip, and they go round and round. Different diagnoses, people just masking the symptoms. Some people are frustrated with themselves because maybe they were finding success with what they were doing before, and they kind of fell off the wagon, and now they're back to having pain again. Ultimately, though, it's people frustrated with not getting results and when they're putting in the time and effort, right? And then finally, hopefully this course will address the desires that people have, right? And most of the time when I meet people with hip issues, they desire understanding and empathy, right? Pain is invisible, so they want people to understand what it is they're feeling and struggling with. They want clear information. They want to improve their understanding. They want to regain independence. They want to get back to work. They want to be able to perform their hobbies like golf and walking and taking the dog out for a walk on the beach, gardening. They want to be able to sleep through the night. Ultimately, they want to get back to normal again. That's why we're all here, and I hope that you'll follow me on this journey as I try to help you get back to normal.